So do you know how many people are on there? Is there anybody on there?
We can get numbers.
They'll tell you.
Does it? Seven.
Oh, okay. Okay. Well, Jody, might as well start our meeting. You want to call a roll?
John Payne,
Here?
Jason Crash,
Here.
Nate Foley,
Here?
Shad Peters,
Here.
Keith Peterson.
Okay, let's all stand for the pledge of allegiance, please. Remain standing for prayer.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Jason, would you do this in order of prayer?
Heavenly Father, we come together this evening so thankful to be in grace. Pray that this time is useful so that we can do your will as you see it fit. There's just so many things that are going on around the world, around the country, and especially it hits home today. So just please let us be about your business today. Please just provide sound wisdom and guidance, Lord. In your holy name, pray these things. Amen.
Amen. Thank you. Be seated. So the first thing we want to do is have approval of the minutes. Everybody had a chance to check through those, make sure there's any corrections. If there are, we can a motion to accept the minutes.
I propose a motion to accept the minutes as presented.
I second that.
Second, Nate, all in favor, say aye.
Aye.
Any opposed, same sign. So we don't have any public correspondence, but we do have a message, Jody, from
Renee Harden.
Renee Harden.
Yes, because of everything that's going on, and even a little bit before that, they're having trouble stocking the Rangeley Resource Pantry. So they're asking for a donation of $500 from the board of Rangeley District Hospital. From the board of Rangeley District Hospital.
Just in case we didn't hear you the first time.
Right, really want you to get that message.
Okay, so Renee represents the food pantry, and you're also part of that, right? with the
Yes,
chamber?
I was recently appointed to the Chamber of Commerce Board, and one of my responsibilities will be participating in the food pantry board.
Can you tell us a little bit about it since Renee's not here?
I have not started acting. I made it to one board meeting so far since I've been appointed. And it was Renee and I and Connie, and that's where we kind of discussed how short they were.
Okay.
So I obtained a list from Renee and sent it out to employees asking for donations. And we've had employees donate food and money. But their shelves are pretty bare. And tonight we're supposed to go down there and drop off a big donation. I know she opens two times a week, I believe.
Right.
But we're gonna start working closer with them in the COVID crisis to get food out to individuals.
I understand they serve, is it like 70 families
I believe so.
a month?
Mhm.
So it is utilized quite a bit. And we often, as a board, when people come, we have our stipend fund that we don't accept. I don't know if anybody looked at the balance, but I just did.
3,000.
3,000, yeah. We just got a big deposit last month, so we have plenty of money in that fund, so if we want to make a decision on that right now, we could vote to fund them the $500 if you think that's a good place to go, so.
I believe it is. I'll propose a motion for the $500 to restock the pantry.
I'll second that.
Okay, all in favor, say aye.
Aye.
Any opposed, same sign, so
Thank you guys very much.
to communicate them that that's what we're going to do, so. Any other comments? We have no other comments from public, so let's move on. Our medical staff report, we have some appointments to approve. When we do that, and if we have any questions about the meeting, we can.
The February 13th meeting, the only thing that I saw is that my last name is pretty butchered. Other than that, everything was as I remembered it being. So I move to accept the February 13th minutes as presented with that alteration.
I'll second.
Okay, all in favor, say aye.
Aye.
Any opposed, same sign.
I'll propose a motion for the reappointment of 2 years to Christine Cassis, Sahal Halal, Adam Koloski, Matthew Lynn, Kier Marshall, Terry Stevens, Eric Lighters, all to Diversified Cardiology and consulting staff.
Second.
Okay, all in favor, say aye.
Aye.
Any opposed, same sign.
So I will propose a motion for the appointment of 2 years for Daniel Baumel to Diversified Radiology consulting staff.
Second that.
All in favor, say aye.
Aye.
Any opposed, same sign.
And I will propose reappointments of 2 years to Robert Kurtzman, Ross Pacini, Kurtz Riggs, and Frank Ross, Western Slope Cardiology.
I'll second that.
Okay, all in favor, say aye.
Aye.
Any opposed, same sign.
I will also make a motion for the reappointment of 2 years to Nadeem Murphy, Kevin Stephen, Izona Bach, Karen Leiserstend, Chad Mausman, Charles Sutton, Abigail Urish, and active staff.
Any discussion on the last?
What's your name?
Any discussion? Okay, second. So have a vote. All in favor, say aye.
Aye.
Any opposed, same sign. I thought maybe somebody might say that you should.
Karen really threw me off, so.
Yeah, I know, it is a funny song.
All right, so now you're instated.
Oh,
Okay, compliance report. Wendy, that would be you. You have a report for us tonight?
Just update you that we purchased the new random software and all of the employees have been entered into the system. I was learning how to pull the reports and separate that out when the mandates started to come down for COVID-19. So we're just kind of sitting right there. Hospital transformation project, Friday, actually that's going to be the 6th, not the 13th. I messed up there. Mackenzie and I went to Glenwood to attend the HTP Roadshow to gear up for the upcoming major selection. This is the hospital transformation project that the state is requiring all of the hospitals to do. The following week, HTP was put on hold for an undetermined amount of time, according to the state, so that the hospitals could deal with this disaster. Quality reporting is also on hold. CMS issued a statement that there are some extensions on reporting for hospital quality reporting while hospitals deal with patient care and COVID-19. Right now, I believe it's 3 months out and they may push that back out farther. Mandates, currently we're paying close attention to all national mandates and state mandates and are applying them accordingly. Last board meeting, I told you that I would give you some education for the board. So this toolkit was recommended by other compliance officers from our peer network group. And once you go to your board member training, if that is still happening, is that in April?
I think it's in August. The next one is August.
Oh, good. So that might actually still happen.
Well, yeah, we're gonna talk about that in a minute.
Okay, so that'll help put everything together too. And then the Yates memo is after the toolkit. That's a memo that came out in 2015. It gives individual accountability for corporate wrongdoing. It's an important memo, especially for boards to read through and understand that if any misconduct is going on, that all of the responsibility doesn't just fall on like the CEO's shoulders. The verbiage actually says knew or should have known. But they actually updated the Yates memo, and I reached out to our compliance peer network before COVID to see if anyone knew where to find the update, but there was no luck before COVID, and now it's the bottom of everybody's list to find right now. So there is an update. I'm not sure what that says. I'm sure when you go to your training also, they'll talk about the Yates memo. But it's important for you to read through and know about and just be informed. So that's all that I have for tonight.
So I have one question for, the hospital transformation project, what is all entailed with that?
So that is something that the state came out with, and they didn't know what it all entailed when they first came out with it, and I kind of feel like they're making it up as they go.
It's kind of a moving target.
It is a mandate that first they called it the community network engagement something. And basically, they want all of the hospitals, like in urban areas, to do what we kind of have to do by the very nature of where we live. They want hospitals to coordinate with clinics and assisted living and various places in the communities with their, they call them their stakeholders and so on and so forth, so that the patients have continued care, only Medicaid patients. They don't care about any other payer, any other patients with any other payer. This is only Medicaid patients. And so it's required, and you must show a baseline, and you must pick a measure, and you must show improvement on that measure, which is going to be difficult for our hospital because we've done this always. And then the measures that they have issued out, most of them don't apply to us, like mother-baby, behavioral health, substance abuse. Some of it is pediatric specific to pediatric hospitals. Like there's a whole list of measures that we're choosing from. Abby and I sat and looked through, and there's some that we might be able to swing. So we're working on it, and that's what Mackenzie and I were doing right before everything came about with COVID. So it's been a challenge for critical access hospitals across the state, and critical access hospitals have been speaking up and really pushing back with the state to make sure that their measures apply to us, because they don't. And the state doesn't understand how a lot of us have our clinic is a part of our hospital, and the state just can't understand that concept. So
The key part of this is that they tie money for
That's what I was
us
wondering, yeah.
to us meeting benchmarks and then improving. So
right,
if we are doing great right now and we don't show any improvement, then we don't get the money.
and they
So we actually are in some ways hindered by having done so much in advance
Mhm.
because they want to see improvement.
It's
So
it's money that's already ours, and then they call it our at-risk dollars. And then those dollars are at risk of us losing them if we don't show improvement from the baseline that we're already at.
and we try to do really well. So that's going to be the struggle. We're trying to pick things that we could somehow try to finagle in our small numbers to see some improvement. Because that's the thing too, if you only have so many cases and you do well in all of those, like how can you show improvement, so.
Right, and if
I'm not saying we're 100%,
if you
but
don't do
it
well
is.
in an area or something, like we do have such a small N number, just like the HCAHPS data, which hospitals across the nation do. We have HCAHPS data also, but our N number is like 3 for the quarter sometimes. And so if you have one person say, gee, it wasn't so quiet at night while I was, during my hospital stay, then you're down 25% or, a third of your, it just goes down exponentially compared to one person saying it in Denver, So it's very difficult for us to get even get a good picture of where we're at with that kind of data. So it will be an ongoing process. So we're building a team, and we're gonna just plow through it like we do everything else, but as soon as COVID's over.
Have they set a deadline then, like, that they will?
They said they don't have they don't have one yet. They just said, never mind, we'll just let you go with this. And we were like, okay.
So this is probably a good time to talk about board education. So Kyle and I and Paulo and Tammy all went to the Colorado Health Hospital Association Rural Health Seminar beginning of the month. And the big topic of the seminar was board education. And so we got a lot of resources and we got a lot of information to help us to train our board and understand what it means to be a board member in a hospital. And I have I thought I had it right at my fingertips, but now it's gone. Nothing never stays at my fingertips anymore. That I wanted to start with tonight. It's a code of conduct pledge. So we're going to pass that around to each one of you. Some of the things that we did in our training, which was really, really helpful, is they isolated all board members in these workshops, while other people went to other workshops. And one of the things that we did is we had a role-playing thing where we got together and they gave us a scenario of an incident in a hospital and how would you respond to this incident. And talking to, I can't think of his name. Benjamin Anderson, is it Anderson? Yeah. He's the head of the rural hospital, vice president of rural hospital for the Colorado Hospital Association. He's gone around to different rural hospitals, and he came to Rangeley a couple weeks ago before all this COVID-19 stuff happened, and he wants to bring us together, our board and maybe Meeker and maybe Craig, to a place to have a seminar and actually do this role-playing model that he showed us at the conference there, and have us work through some problems that we would learn how to respond to certain things. If you read through this code of conduct pledge, this is one of the suggested conduct pledges that they gave us. There were some other ones too. I thought it was really good. Our code of conduct pledge is not as elaborate as this, I don't think. I don't even remember if you signed one. Did you, Keith? What did you sign? Or you didn't either, Shad, did you?
No.
I remember I did. We did, Jason. So I don't even know where that's at, but I think we should adopt this one. If you read through it, it's really pretty comprehensive. But the other component of that is having ongoing training for what it means to be a board member. They talked a lot about governance rather than just being a member of a board, but how do you govern the board and what kind of criteria do you use to do that? And what kinds of protocols do you have in dealing with issues that come to you maybe from a community member, or issues that might come to you from a staff member, things like that. How do you deal with those things? And we need to have some conversation. I don't know, when I first went through this, I thought we'd spend most of our time tonight talking about that very thing, but I think we have some more important things to talk about tonight. So we're going to I just want to give you a taste of this a little bit. We'll be talking about more, hopefully, our next meeting when this subsides a little bit, I hope. We don't know that, but we'll see how that goes. Do you want to add anything?
I just wanted to, I'll touch on it some more, but in the scenario, the example was a new CEO coming into a facility, a rural community, and they had a physician, a hometown physician that came back to the community and was misbehaving, had an alcohol problem, and so he had to do something with this situation. And he just tied in how the board handled it and how the board president was mixed in the whole thing because he's a longtime resident there in the community, and how he had to go, and the CEO ended up firing this CEO that was, his dad was a doctor there in the town, and that was his son coming back. So it was an interesting scenario, and I could see it happening in a small rural community like ours, and there's a lot of pressures coming from all different angles. So.
But it really helped us to understand what our role is in those situations, and so we'll talk about that again some more, and get into. Hopefully, we can now schedule that training time that we can have when he comes up here and brings us and gets us together and do that. Hopefully, we can all participate in that, because it was I think for me though, the biggest takeaway of the whole conference was just the idea of a relationship between board members and the CEO. That relationship has got to be a developed one, but it has to be a solid one. We have to be on each other's side, and we have to develop the relationship. It's a good opportunity for us with Kyle being new and some of you guys being new too, but we need to be proactive in developing a relationship so that we're working as one. And things don't come up that divide us. And that's the other thing. We need to be communicating with each other and talking about things so that we can have a solid front when it comes to dealing with issues, or even just having a good time. Right now is going to test us a little bit, I think, with what's going on. We're going to have a lot to talk about tonight with the virus. So I think that unless you have any questions about any of that right now, we can move on to that. But I did want to bring it up tonight and make sure you're thinking about, and I'll be maybe talking to you more individually a little bit more as we go along, get past some of this other stuff. So, okay. So, are you finished then, Wendy? Okay, thank you. So, that brings us to financial report, right?
So financially, our cash moved kind of like we expected in February. We got a check from the county for our tax levy in March for $2.1 million. That's 57% of our levy for the year, and that's going to affect our cash balance for March. But as far as the budgeted numbers and stats are projected over the entire year, and it listed at 1/12 per month. There's substantial variance month to month in the actual numbers, so no trend should be inferred before we have 3 or 4 months of data. Medicare payments, they're still higher than expected. We've had, as you can see in the stats, we've had more inpatient and swing days than our benchmark would indicate, but we're also still getting a lot of payments from the whole slew of SNF visits that we had at the end of last year. So that puts us in a pretty good cash position for the current situation, because to prepare for this, we've cut down non-essential services. PT is no longer doing home visits. They're only doing they're only seeing ortho patients. People are canceling visits if they don't feel like they need to come in. So there's going to be a pretty big impact on our stats and revenue over the coming months. But we're in a good position for cash right now.
Could you back up to the SNP days? I thought we
Yes.
were gonna lose a bunch of revenue. off of that at the beginning of the first quarter of this year?
Well, no, so I believe that's gonna come when we actually have to file the cost report, and that's kind of been pushed off a little bit. But basically with that, that'll be affected later in the year, but
Okay.
yeah. As far as profits and loss, our revenue's 4% more than last year, but 1% under what we budgeted. Gross profit's 6% better than last year, and 9% better than what we budgeted. Expenses are 18% more than last year and 6% over budget. A big part of that has to do with purchase services. We had a locum PT, locum doctors, and locum nurses, and that all adds up. Payroll expense is 2% more than last year, and it's also 4% under budget.
So
I think that's,
that was the red flag I had, was the locum costs are really, I mean, 145% of last year. Is that something we see that will start declining now we have a new practitioner and another nurse?
Yeah, it'll start to decline here because that was part of that budget was the nurse practitioner was from a locum company. And then we had 5 nurses for locums.
Yeah.
So
I believe we just hired an LPN today,
We did.
so that's gonna help things out too.
So we hired a new nurse and an LPN.
Okay.
So we'll free up some of that.
We're still short then, or?
We got
Okay. Another question I had on the income line, because we see a big, in the expense line, Senior Life Solutions has a big $76,000 expense, but have they no income yet to report, or is that gonna be reported on its own line
Most of the revenue from Senior Life Solutions will be reflected on our cost report.
on the cost report? So we
Yeah.
don't see it as a line item?
Yeah, Yeah, well, so I'll have to get back with you on that, but I think that goes into the other revenue.
Okay,
But yeah, the main place where we're gonna make money on Senior Life Solutions is when we do the cost report, because we can include that square footage.
right. And I understood that, I just
Yeah.
didn't know if we'd have a line item for that. To know kind of how reflect how it's doing.
Mhm.
Because I know it's on hold also right now, right? With what's going on, so. But I was just curious how that was gonna reflect in the income side.
Jim, is there gonna be a line item for Senior Life Solutions? Or is that just gonna be reflected on the cost report?
Sitting in other revenue, and right now, that item would be about $38,000 in revenue, and it's costing us a lot more, because like you said, most of our payments are going to come in the form of a cost report, where we expect to make maybe 75 to 175,000 off of the whole deal, but we won't get that money until the cost report is filed and paid.
Okay,
So it is a line item, John. It's just in the detail under, from what you guys are looking at on the, email you got,
right?
it's in on the revenue.
Okay. Yeah, I just thought it'd be a good idea for us to keep an eye on that since it's new, and I wanna, we were talking about that it would be a good moneymaker for us. I just was curious.
Well, we can set it out separately on the report if you want, on the work report.
Yeah, it might not be prudent right now.
Separated.
Yeah, it might not be prudent right now since we're kind of in a different mode, but maybe in,
Yeah, it's gonna be kind of zeros for a while here, I think.
right, okay. We'll come back to that, but I was curious how that was gonna be reported as well. Any other questions on P&L, or we can move to questions on the checkbook or balance sheet.
I just have one question, the LP treatment room revenue.
Mhm.
What is that exactly? That's 365%.
Yeah, that largely depends on the mix of procedures that we've got, because we have some procedures that bring us less revenue, but then we have also endoscopies and colonoscopies that bring us more. So it's basically a mix on, what we're seeing patients for in there.
Yeah, I noticed
Yeah, and
that.
those are small numbers too. I mean, you're looking at 31,000
Right.
versus 24 for budget. That could be just a couple of procedures. And last year was really low, so that's what led to that percentage.
Cash balances are what expected there, but they're still higher than we've been in a while, so.
Yeah.
That is a good thing. I've
Well, it's thanks to the people that voted for the taxes, because with this thing coming up, I mean, it's really good to have that money coming in.
Right. Because we might see a kind of a lean time for the next couple of months.
Yeah, and in fact, it could go on longer, but we're in the best position we could be in.
Right. So any questions then in the check register? One question I had though concerning locums again, is their availability gonna be restricted because of this COVID-19? Are we gonna be able to get?
Well, what we're worried about is one of our current RNs or physicians getting sick and then not being able to get somebody here in time.
Yeah.
So we reached out to some of our retired doctors and they've offered to come and help if we need them. So if Dr. Yurish happens to get sick or we've reached out to Dr. Teen, Dr. Deb Smith, and they said they'd come fill their spots if we need them.
Well, I was just wondering too, if just locums in general will be a shortage around.
I'm sure.
I'm sure, yeah.
Yeah.
And I know Paulo's gone from 3 RNs on nights and weekends to 2 with 1 on call to kind of help preserve the health and
Okay.
Well, if nobody's got any other changes, I propose a motion to approve the financial summary for March. Or for the month of February.
I'll second.
All in favor, say aye. Aye. Any opposed, same sign. Okay, Kyle, why don't we move to your report and what's going on in the hospital right now?
Okay, first I want to say thanks to Blue Mountain Energy for donating the masks. We've had other community members also want to help out with making the surgical masks, cloth masks, and I think Andy Schaefer called me today and somebody wanted to donate some nasal cannulas. So, the community's really stepping up and helping out. I'll go through kind of an update on things that I had on here previously so you guys know, and then I'll talk about the COVID-19 update. The phone update, that'll be ongoing for a couple of months. We have hired a nurse with the recruitment efforts, with the phone ad or the radio ads that we've had out. Also an LPN from Bernal, and then there's a home health travel nurse that's interested in staying as well. So our recruiting efforts on that end is looking pretty promising. John mentioned the CHA meeting that we had in Denver, and Benjamin, the vice president came out here. it says 4 physicians within the community. It's going to be 4 physicians within a rural facility, so it's not just our facility, but he has a recruitment plan for some, the residents, resident doctors, to get them into the rural communities. He's looking for a specific type of physician, the ones that are mission driven. And then he wants to get 15 to 20 of these physicians, and he's going to fly them around to different communities and introduce them to the communities. So it's our responsibility as a community and board members to make them feel welcome, to make them feel like they're at home, and to have that emotional connection with them so they'll feel at home and stay here. And it goes beyond the hospital walls. It goes, showing them the college and different things and cooking them a home meal, things like that. It's really going to bring them into our community. So I'm excited about that, because before we went to that meeting, I was reaching out to some headhunters to see if they could help us out, and the costs are pretty expensive to recruit a physician. So I was excited about that and his plan, and I really think he'll help us out in the recruitment effort to get a couple of physicians here. So I'm excited about that. All other unnecessary or non-essential, I guess you could say, things are kind of put on hold. With Senior Life Solutions, we've put those visits on hold. Catherine, she's still reaching out via phone to the couple of patients that they've had. That leaves Lori and Lisa that are still in Senior Life Solutions, and Lori's taken some billing classes, and she's also helping us out with the pharmacy. And Lisa, she's an RN, so we're going to use her and train her on long-term care, so we can use her on the long-term care floor. So we're not just paying them out some money and not using their services. So we kind of have some options there. We signed a contract with CSD out of Grand Junction for our yearly audit for our cost report. That also, the cost report has been pushed back, so that's not due till a later date. We've had more discussions about a rural health clinic, and we're still in discussions about that. They don't reevaluate our area for a provider shortage area, which is key to even looking into this until August. So we're kind of waiting for that time period. We're going to get things prepared, find out more information on how to do that and what the transition is. Board elections, Brad Castro, Chad Peters, Diane Sizemore, and Keith Peterson are all candidates. We were thinking about doing the a live in-person forum, but that's been put on hold. We still would like to do something like a question and answers maybe. So we might have that somehow here pretty soon.
So when is the election for sure?
May 5th.
May 5th. So before May 5th, we'll have a question and answers section set up for you. And the CNCC Foundation has been moved to an online auction. Is that still true, Keith? I haven't heard anything else.
Yeah, I checked on that today. As a matter of fact, it's still going to happen as an online function. We had hoped to kind of make a production of it, but our own social distancing restrictions are even going to make that a little bit less than we had hoped. So it may just be Sue and I asking you to buy stuff online.
Maybe you can do like infomercial style.
I fancied that I would be an excellent QVC host at one point, and I feel like this is my audition tape. So tune in and we'll see how fun we can
Are you a
make it.
hand model too? Is
I dabble.
I'm wondering how big they can make your hair look.
Right,
Yeah.
right. I listen. If people buy a few things, we'll be happy. But yeah, no, that's unfortunately such a big event for us, and usually such a fun night as well to boot. But we're going to do our best to, given the circumstances, for sure.
So along with that, we purchased 2 tables, and they're offering to refund the funds for the 2 tables. But another option is we can donate that money towards their cause. But that's the board decisions.
I think the mine was gonna do the same thing, so.
Yeah, I think that's a good idea to do that myself. If we need a decision, we can do that, but I think all of us would agree, right?
All right, the health fair has been postponed till further notice. Now the COVID-19 update. You guys all have this in front of you. It's just a current hospital capacity. This is looking over, the top model is looking over 18 months. The bottom one's over 6 months. These are just projections. It tells you that 20% of adults are infected, and then it shows you kind of how, it'll affect the whole country on this COVID-19. What they're trying to do, if you go turn to the next page, is they're trying to prevent that big spike where the hospital capacity overfills. That's why they're putting in all the restrictions, all the regulations. They're trying to spread this impact out so the healthcare capacity can handle that. One way to do that is to improve the throughput. So they've waived a lot of restrictions on and mandates of how long we can keep a patient and transfer them out of the facility. So say St. Mary's gets full and they have some lower acuity patients, they could possibly send them to us, and we could send them the higher acuity patients. So that's an option that they've been throwing around. The other idea is creating new beds. So they've talked about open up hotels in Denver area to fill hotels, with patients that they need. So we've been offered, Ron at the college has offered to open up Ross Hall.
Yep.
There's 80 rooms. They all have their own bathrooms. So if the need ever arises here, that's where we'd probably, staff and send some patients. So it all depends on what's coming down. So
Can I ask you on the chart, because the spike chart that we see here and flattening it out over time, that's like a chart that you see a lot
yeah.
in a bunch of different formats. Do we know how we're doing in comparison to that? I've been seeing like this particular chart or an iteration of it since, this first became a concern, but obviously there's tens of thousands, almost 100,000 cases going on in the country right now. So do we even know how we're doing in comparison to the worst case scenario versus if we were, like, where are we at now?
Yeah. So these are all just projections. They're just predicting what's going to happen. Right now, we're just on the uptick. So we're just barely starting. From what I've seen, the data from like China, Italy, it's been lasting month and a half before it starts to level off. So we won't know until mid-April when the peak hits of where we're really going to be. So
I will say though, yesterday, I think I saw someone had published trajectories of cases and because they look at when you first get your 100 cases and then doubling rates after that. And so I think yesterday was like the 20th day since 100. And we as a country bypassed China and Italy for our trajectory. So that was not good news. I think a lot of that is because we have these really populated areas like New York that have now hit. So, I mean, we're less than the worst case scenario, but and who knows if China's data was all correct,
Right.
it looks like our trajectory is higher than, and it's steeper than some of these other countries so far.
So just the protective measures we're taking, which are increasingly aggressive, probably could have been more aggressive on the front end. So for like people in Rangeley, it's different, right, than in a metropolitan area where you've got so much density that there's the potential for it to spread a lot easier. What would be the message for our constituents if they ask, are the protective measures that the hospital's taking, the college is taking, the public schools are taking, are those sufficient to calm nerves that, it's probably not going to be as substantial as it would be in a more densely populated area, or is it too early to say those kind of things?
Do you want me to answer?
You go ahead.
I think it's really tough, and I think I'm gonna be talking about it a little bit later, and that is like one of the most common questions that I get is, what is our projected outlook in Rangeley? And, the tough thing is I feel like I'm an auto mechanic who has only worked on, BMWs, and somebody's talking about like, I don't know, Fiat. Like, I really don't know the car. I don't know if that's a good analogy. I'm not a car person. I'm really not a car person. But like, for us, I haven't seen it yet. So we really don't know what it looks like. And the scary part about it is that it can multiply so quickly. I think not being a highly dense area, I do think that's why you see on the maps of Colorado, why the northwest corner up until today with Moffett County was totally white with no cases, is because we like going out to our goats and our cows and not other people. But that doesn't mean that if we start school again, or if we were to, put people in the same auditorium, or, that we wouldn't just have a wildfire, because we don't have the capacity either for 200 people to get sick at the same time. So
One example of what we're doing is anybody at our facility that has children that aren't completely healthy, maybe have some immune deficiencies, we've just given them time off. They just are home quarantined. And then starting Monday, we start our phase 2, where we take temperatures of everybody that walks through the door. If they're 100 degrees plus, then they get sent home for 2 weeks. Restricted all travel out of the county. If anybody travels out of the county, they're off for 14 days, so quarantine, so.
I think, the biggest question everybody has is, are we being because we are in this, a sparsely populated area, are we having to take these extremes? Is that necessary? And I think we have to have a message, and with that, I know you're gonna talk about the emergency operations that started. That's what we need to have, is a clear message. And that's why I wanted Dr. Abby to be here tonight to answer those questions. So we don't have people out there saying, well, I don't have to do this because I think it's a farce, or I think it's overblown, or I think, yeah, it might be, but at the same time, it's very serious. And I wanted you to talk too, you shared yesterday about some cases that were pretty, severe things that happened. We talked about somebody that died that didn't know they were isolated themselves. They were self-quarantined. They ended up dying because they didn't get health care. They didn't get things they needed. So this is a serious thing, and we have to take it serious because nobody knows who has it. Nobody. We could all have it right now. We don't know it, but because it takes a while for it to show up. So, but you opened my eyes yesterday when we were talking about how it's not even close to spiking yet in Colorado until another couple more weeks. That's why they're doing this lockdown. They want to try to prevent that spiking to happen.
And for us in Rangeley or the outlining communities, it's just gonna hit a little bit later. So, it'll take its time to get here, but it's not a matter of if, it's when, so.
And that's kind of by design, so that once it's gone through the big cities, hopefully once it hits us, we have some beds open up where we can transfer higher acuity, I can't talk tonight. And also some ventilators open up, Because if it hit us the same time as Junction and Denver, we have nowhere to send our patients.
And that's the thing, if, we only have, let's say, 15 patients that get it, severely, we can't handle 15 patients here, right? It's devastating to those few patients, because we don't have a facility to handle those things, so.
Yeah, so I mean, I think the message, because one of the things you asked is how well are we prepared? I think I want people in Rangeley to realize that, like, if you were to get COVID, I think this is a great place to get it, because we have amazing respiratory technicians. We have a CNO and a CEO who are new and young and energetic about taking measures to take precautions. We have our CEO who's in charge of lab. So that means when we need to get these COVID tests, they get done, which is really, really important. Our physicians and nurses, and our pharmacists, we've all been working really hard to try to get the supplies that we need. And I think, there's still things that we worry about, because in a worst case scenario, you can't have, 300 times of everything as a spare in a closet in a small town. You just can't. Like, it doesn't make sense financially, but I think we've prepared ourselves well with good equipment. We have a new portable x-ray. We talked about that at the last board meeting. We've gotten these 2 high flow oxygen things that we originally thought we couldn't use with COVID, but there's been more data about those now that we can use them as long as we have a contained field for the patient. So some of these purchases and things that people question the cost for a small community, auspiciously, we've gotten this pretty new facility that has things that are up to date, that are going to be top notch, in terms of technology. So, and we've been judicious with our testing and our protective equipment so that we will be prepared. And I think in terms of the preparations that we've taken for the facility to lock us down, to keep our patients that are basically permanent inpatients here safe, are gonna be protecting them. We have telehealth now, so that people who are sick, who are minorly sick, we can take care of them at home, and no one's gonna bat an eye if I prescribe antibiotics and I haven't actually looked in your ear, or I haven't actually looked in your mouth if I think you have strep. Right now with the pandemic, we could do all that on a computer, on a phone, and take care of people without having them walk through our facility with a fever or with these things that, unless we do COVID swabbing, we can't be 100% sure that they couldn't be bringing in this contagion to us. So, but the real caution message is that, 100 people died in New York today. Like, 100 people. They brought out cold freezer vans to start dropping bodies at one of the hospitals. And what the story that I told yesterday at our med staff was 2 healthcare workers that died in Georgia. One of them was a physician that had self-quarantined at home, and it was a basically welfare check that found him dead and out. Like, so what can happen with these cases that look at mild cold symptoms is they go home, they stay at home and are quarantined, and 2 weeks later, their lungs fill with fluid, and you have like this 4-hour window to really intervene. So, and that's one of the things that we're discussing, but I haven't actually seen this, like I mentioned, but I'm with a lot of doctors on social media. I have a network of different colleagues that I went to school with and did training with, and they're all telling me I've never seen other doctors get so scared. So, I mean, to me, that's the real caution is, I got terrified when Ebola came out, because that'll kill you, and it is like super contagious. This seems, I can see why people think there's politics involved with the year that it is, with our current gubernatorial candidate or elector, whatever. I can see why we think politics are playing into this, but if you look at the actual numbers and how fast people can decompensate and get really, really sick really quickly, it's serious. So it's not a small matter. So I think the reality is, when you look at the death toll going up, we're not so separate. We wish we could be an island somewhere else. A lot of times we wish we could be probably not part of Colorado and maybe be part of Wyoming or some other state. But as it is, we still get a lot of employees with Chevron, with the college, people that are traveling to these high-risk areas. So this isn't by any means closed door for us for it hitting. And if and when it does, which the question is really when, is how bad is it going to be? And I think as long as our guards are up and we're really vigilant, protecting our hospital, not just our patients, but these employees as well, so that it doesn't spread, I think we'll be able to be in good stead. But I don't know if that was a longer answer, but that was kind
No,
of what I thought you were kind of
I
planning.
appreciate the answer very much. I think a lot of people probably just need to hear exactly what you just said.
Yeah.
You know, there's been this spectrum, and Keith included, of people go, well, come on, right? Like, this isn't a big deal to, holy cow, I can't sleep tonight because I'm so nervous about this.
Right.
And probably somewhere in the middle is, this is what we're doing at a reasonable level to take precautions to protect the community. And I think people probably appreciate hearing what you're saying. I know the feedback that I've received so far about just what's happening up at the hospital. I think people are grateful for it, you know, like so it takes 45 seconds out of your life to fill out a little form when you walk in,
Right,
but that's a whole lot better than what the consequences could be if you don't.
right.
And it's really a small sacrifice in comparison to how bad it could be. I'll say as well, I know you've been a big part of it. I was recently this week had a telemedicine appointment,
Okay,
and it was a fantastic experience.
great.
Like you couldn't have convinced me years ago that I would ever want to go see the doctor over the internet. I won't even do Facebook.
Yeah,
But, you know, in a time like this, to be able to literally just take 15 minutes out of my work schedule and sit at my desk and be able to have the same experience that I would have if I would have physically come up here was an excellent experience. And so I appreciate that very much as well. So.
thanks. And that is good to hear, because, you know, that's one of the things I think I've tried to get as many people to do that as possible, because it is so easy. Like, if you have a smartphone, it takes 2 seconds. You don't have to fill out any kind of information. You put in your name and that's it. And then you're talking to the doctor. And, you know, there's always hiccups with technology. So I'm not saying that, you know, if you don't have great internet, there won't be some issues. But I agree. I think it's really a great modality for people to get what they need.
Right up to the point. Like, I was like, oh, I can't believe I'm doing this. And then I was like, oh, that was nice. So yeah, like totally sold. Everybody, that's a good thing.
But we need to be the liaisons to the community. That's why I was really excited about having us here to talk about this thing, so we can get the right information out. It is serious. If we take precautions, we'll be good, but we can't just ignore this and make fun of it all the time and get mad because we're made to do something we don't want to do. And nobody likes that. I mean, everybody's hurting because of this, and financially, and it's going to be a big thing for all of us. I'm not trying to minimize any of that. But we have to, it can be, the economic impact can be devastating, I know. I've said it 100 times. Every time I watch the news, that's what I'm saying all the time. But at the same time, after going to these meetings in the morning and hearing how severe this is, I guess I've become a convert too. But it's something that we need to be able to communicate effectively. If we can't communicate, we need to have them call Abby or call Kyle, because or anybody here who can answer those questions. We need to get them involved and get the right information to people that are skeptical about this. And we'll get through it. We will. So.
Yeah, the good thing is there's 0 confirmed cases in Rio Blanco County. The other thing we got to think about is it's taken a long time to get here. When it is here, you know, we just got to keep up our guard even that much longer, you know, until it leaves the community. So there's 0 in Rio Blanco County. There's 912 confirmed in the state of Colorado. What's that?
That's yesterday's data.
Okay.
There's over 1,000 now.
Over 1,000 now. So I'll just go to the last page on that handout that I gave. It just shows you like the traditional emergency response and then what COVID-19 is emergency responses, and even the state said they weren't prepared for this response because it takes a lot longer. It's an extended period of time, and we pretty much shut down the facility. We don't, we're not doing any non-essential visits, so it's pretty much ceased to operate. We still do the clinic, the telehealth, so we have reached out. So in response to that, Thursday, Ty Gates from the county, I sat down with him and we were talking about how to activate our emergency response to this. And we have a facility plan. It's our emergency operations plan. And we activated that. And that next morning at 6:30, we started doing an incident command post in the boardroom. And you can kind of look through it. We have 8 objectives on there. A lot of it doesn't just stay within the walls of the hospital. It's community wide. We have the town, the county, the college. So there's a lot of people that are on the call. And I talked to John Monday, invited him for the Tuesday morning briefing, and then got him involved in the briefings, and he's been there. So to update you guys, we do it Monday through Friday, 6:30 in the morning. You guys are welcome to join in. I can get you the phone number and the passcode. You can sit in and listen in on it.
Or participate.
Or participate, yeah. If you have suggestions or ideas, then you can jump on. So it started out with our facility and the county, and Pioneers was listening in for a while, and now the structure is set up that we have our incident management team here at the facility. Pioneers will have an incident management team at their facility, and then the county has their incident management team for the county-wide, and then they're going to be supporting both hospitals. So if you have any questions about it, you can ask me, but what came of that is everything on this list, the COVID-19 coronavirus information, and really everybody, all of our staff, the town, everybody's really chipped in to help the community and help the vulnerable population that's going to be affected by this breakdown in our economy, really. So there's a list of things that are happening for groceries at White River Market, banking, the restaurants that are offering their services. The thing that the hospital has is the Meals on Wheels that we operate through our assisted living. And I was gonna let you know that we are gonna expand that. If you guys have any objections or thoughts or comments about that. Right now, I think there's 10 or 12 people that 13 people that they deliver to now. We're gonna make that available to the populations that's susceptible or at higher risk for the COVID-19. So we're just gonna expand that service. We're gonna have our dietary staff here in the hospital cook as well, and we'll expand that service.
How is that funded?
So that's funded by donation. So Chevron has donated quite a bit to that. The account's sitting at about $13,000. So that there's some funds in there that we can use.
So have we thought through the application process for that, or is that
Yeah, so
just the phone number here for the
they'll call the number, and Stacy Shriver with Eagle Crest, she'll go through the application process so they can get signed up for it. There have been several people volunteer to make deliveries and help out with that. we've kind of gone over, we're just following the CMS and CDC guidelines as far as screenings. We've opened up a drive-through collection. It's a collection site where we collect the samples Monday through Friday from 12 to 2. We've had several calls. I think we've had 4 or 5 actual collections and samples sent to the state, and that's coordinated through county health. We do also have a reference lab that does the test as well, but it's at a cost, so that would be charged to insurance or pay out of pocket for that. But it's another option. If they really, really want to get tested for it, then they could do that. The expansion of telemedicine services, that was headed up by Dr. Urish. She got on the ball with that, and we got that set up, and it's really been successful. Pharmacy, we're delivering to the front door if they have any type of respiratory or fever, or we'll deliver it to the door. We also will take it out to the community, and we'll take it to Dinosaur as well if they need medication. So they'll pack everything up. If there's 4 or 5 people that need meds in Dinosaur, they'll make one trip out to Dinosaur and deliver there. And I think that's about it. If you guys have any questions, or I think Dr. Urish kind of touched base on the infection. It is highly infectious, so like the flu is, I think you can infect maybe 1 or 2 people. This is 3 to 4, within a 6 feet circumference of yourself. So and the incubation rate, it takes a while for you to develop symptoms. Some don't even develop symptoms at all. So.
And unfortunately, what they're saying is that you can be contagious for 2 days without symptoms, but usually the early symptoms are these minor cold kind of symptoms. In terms of treatments for like long-term, there's a lot of studies out for antivirals on this. There's not been any data to really support one thing or another. I mean, first of all, I'm not an infectious disease specialist, so a lot of ER doctors and ICU doctors, we're all trying to handle this as best as we can through the network of education that we have through email and, social media. But one of the treatments that has been suggested is this old malaria drug in combination with azithromycin. And it does seem to have some good outcomes. And we have been able to work with our pharmacy to get what we need in preparation for possible treatment of folks. But there's not really clear, like, this is the easiest thing. And I think that's the scary part with this kind of infection, is that it really, it causes so much inflammation in your lungs that they just fill up with fluid. So you get something called ARDS, and that's basically really difficult to manage. And most patients like that end up in the ICU. And if you look at the numbers, you can go to the Colorado CDPHE. While you have some of our early deaths in the state have been elderly folks in their 70s and 80s were some of the earliest cases. We have people in their 30s that are on vents, so it's not like any one of us is safe from this. That's the message. I think that's important. While we've had no pediatric deaths across the nation that I'm aware of, things change every day. And so we think kids are safe. They're usually the carriers. And even that, I just, nobody is safe from this disease, and certainly more comorbidities have worse outcomes. But 30-year-olds with no health problems being ventilated is a scary kind of thing to look at. So, especially when you realize you're 30 something.
So I've heard it called quite a bit a disease, but I've also a virus. What is the difference in terminology?
So a virus is just a type of disease, so a disease process would be even, hypertension could be considered a disease because it causes some pathology in your body. So a virus is just a type of disease from that specific infection, so. And coronaviruses typically are just colds.
Yeah,
So it's these SARS and like, SARS is one of the other ones, MERS was another one that was in the Middle East, and then this COVID are just nasty. They just make you make so much fluid that you feel like you have the flu, just kind of mild. Some people, and then other people get really, really sick, so.
Do you guys have all this information posted on your Facebook page or any place else?
What in,
You're seeing
Like
this
the
before
COVID.
this went on Facebook, but we've been up in,
Telehealth and all that?
oh, yeah.
So that's one thing that the ICS, the command center, we have public information officers. Jody is the public information officer for our facility. Ronnie from the county has helped out, and before anything goes out, it goes through them, and then I approve it, and then it goes out to the community. So the structure of our operations plan is working really well, as far as flow of information back and forth, so.
And we may just add on to this, Jody, about donations. So I don't know if you guys have heard about all the cloth mask donations and everything. And some of you, because of your backgrounds, may be familiar, but the N95 masks are the ones that protect us from 95% of particles. Regular old cloth masks, even the ones that people are finding online designs for, only cover about 60 to 68%. So for my nursing staff, that's not adequate by itself. So we will receive donations because cloth can be used as a backup if we've used all of our other resources. And we've talked about maybe using them to throw on to cover our N95s, but by themselves are not adequate for coverage, particularly for this virus. So donations that we really appreciate are these N95 masks, nasal cannulas, other medical equipment that's been unopened and unused. And I think Jody knows who through the emergency operations would receive that. You told me the name and I don't remember that. The last thing that I wanted to say that I forgot to mention earlier is this is a huge mental health issue because people are losing their jobs, their incomes, so we are going to see probably a rise in suicidality. And so, we need to be social distancing, but also checking in on each other. And as part of our community's response, obviously we will do telehealth through our clinic, but Mind Springs is also doing telehealth visits for counseling and their psych. So don't forget that piece too.
Michelle will be on call.
Okay.
Well, I think you've addressed a lot of the questions that I think we have, and that's the information we talk about in those meetings. The information to the public is key to this, that we get the right information out and be cohesive, and that's what that operations is supposed to do. So I think that's going to help. So, but any questions anybody has, I hope they feel free to not ask their neighbor, but call up here and ask the hospital, the professionals who can answer those questions. I've heard that testing is a big thing. If we could test more people, we could find out who has it, who doesn't a lot easier, but testing is not that easy, is it? And it's not that quick and.
No, so you can speak to that.
Well, the turnaround time is, I think it was a couple of days ago, it was like 4 to 5 days before we could even get results back. And it's even longer than that for us because of where we live. And there's a lot of publication and on the news, they say you can get these rapid tests at home or you can get these rapid tests, but the demand for those are so high that the chances of us getting them is very low. We do have an analyzer that does a respiratory panel, and we contacted the manufacturer and they'll have it ready in June. So it's a little late, on the production side of some of these tests to get results back. So having it in-house is not likely, but the turnaround time for the state is going to ramp up, and the turnaround time for our reference side also will ramp up because they test a lot quicker, so.
It's probably important to mention too that we have a limited supply.
And
of these tests.
the kits that we have, there's a limited supply, and that's why we've been very selective, and Dr. Urish has been very selective on testing everybody that walks through the door.
Not testing everybody.
Yeah, not testing everybody that walks through the door, because we only have a limited supply. We've already been contacted by Pioneers to send them some, so people are reaching out to other facilities to get the swabs and the test kits.
And the concern is if we test too early, we won't have, then I'm gonna have to test the same person twice, because, so we are really judicious with that, which probably is difficult. People wanna know, do I just have a cold or not? But the want to know is not, weighing for those people that, are coming in, being admitted to the hospital. That is a huge priority. And there are other risk factors that we're looking at. So if you hear any grumblings about that, that is why. We are limited capacity for that, and we don't want to do duplicate testing. If we really think it is, we want to know, but not just for people's knowledge and
And that panel
Curiosity.
runs at $1,400, so. But that's for sure.
Dr. Sue was saying.
oh, you mean
The one here?
The full respiratory bag is what Dr. Sue was saying.
I think it's around 800.
So is cold and flu season still
yes,
in?
until the end of April is usually.
And with this wind, allergies are.
And seeing that's the
Yeah.
other ones, allergies are just.
Yeah, I
In our
know.
morning meetings, that one guy sneezed and the whole room.
Yeah.
That's what the stockpile of toilet paper is.
Uh-huh.
Everybody else in the room.
So, yeah, I don't want the community to be concerned because we are prepared for it. We've done mock trainings. We've been through several discussions on what we're going to do with a patient that's positive, and I think the community has to come together because there's so much publicity on this that the first one that's positive, we're in a small community. And we'll keep all the HIPAA and won't share anything, but it will get out. And we got to be concerned and check up on that person, because if everybody isolates them, like Dr. Urish said, then no one's checking on them. We need to check on them, make sure everybody's cared for. So.
One thing I didn't see on here, which at some point I'm sure you're probably gonna have to do this, I don't know this, but if I didn't see a hotline in here, do you think you have the coronavirus to call in before you even come up here?
Mhm.
Kind
Oh,
of
yeah.
like telehealth?
So
we
that's
can-
that number, it says, the collection site. We advertise that 970-620-3969 number. And-
Which one's that?
Under medical services. Rangeley Community Medical, RDH, COVID-19 collection service. To the right there's a phone number.
620, that's a cell
It
phone.
might be better just
To
spell
clarify.
that out.
Yeah.
If you feel you have these symptoms or you feel you have this
Especially
illness,
for elderly.
call in prior to coming in, because that's on all of the Colorado websites.
Right.
With the collection site, they call that number, and we can find that better.
Yeah.
They call that number, and then there's a screening process that
That's what I was
they go
getting at.
through. Yeah.
And
That
nursing has that in a cell phone on them at all times.
Okay.
We
Well,
have,
I believe it's from 8 to 4 for the
Okay.
call for the
Yeah.
COVID screening.
we have published that like on our Facebook page and things like that, just
Okay.
not on this.
Okay.
That's good, I
Right
think
here.
that, you're right. That should be-
But yeah, we'll definitely fold that up.
And we could add Mine Springs on here too in terms of,
Mhm.
for that.
Exactly. And the donations.
What I think is amazing is our staff has been so flexible with all the changes, because even as we give you data, we're giving you data from yesterday. This is such an evolving problem that it changes so much that nursing, all of our staff have jumped into, we gotta change this from day to day. Even our screening things have been adjusted and tweaked to try to find the best thing. And I think it's just, it speaks to a resilient and, amazing staff that we are able to do that and come together.
Well, even on that note, I feel strongly that those people also need the most checked on because the constant stress, the barrage, the testing, is this available, is this not, and they're being the front line of it. You got doing checks on them to see how their mental state is.
That's our number one objective on our emergency plan is the well-being of ourselves. If we can't take care of ourselves, then we're not going to be able to take care of anybody else. So, yeah, I agree with.
We continually try to make a plan to go check in with them or have a barbecue. A small, not
I was
a
gonna
large,
say-
it changes every day
Can
now.
no more
Before
than
we
10
could have it
people
no more than
barbecue.
10, and now it's gonna be, there's the grill, go get your food, but something nice for them, whenever. But we do check on each other and check on them all of the time.
Well, I think we need to acknowledge that our staff is doing a great job and we appreciate it very, very much. As a board, I know that. We want to express that publicly and also in the minutes and everything. So, any more questions specifically about that? You do have to talk about the emergency plan for the finance.
So I have a meeting set up tomorrow with our lawyer because I wanted it to pass through them before we declared an emergency, like at the facility, our district, as a disaster declaration is what it is. So I have that out to our lawyers and I have a call set up for tomorrow to talk to them about that. What we do with our emergency operations plans, we all have badges and we scan in when we're working on the COVID-19 incident and we scan out. We're keeping track of all of our financial data. Jimmy's tracking hours, putting it into payroll and hoping at some point we get reimbursed for all this.
Yeah,
So,
they are working on public assistance from FEMA. They haven't really finalized anything just yet, so we're tracking everything just in case. I did read today about a grant. I don't remember precisely. I think it's from like some kind of Colorado insurance pool where they're guaranteeing they're going to reimburse 100% of preventive stuff like PPE stuff to encourage social distancing, that sort of thing. There are a couple questions I'd like to ask them before I submit some of the expenses that we've incurred so far, but we are tracking that.
yeah, so if we do declare our district as a disaster, then I'll need approval from the board and the president, so.
Does it really have to be declared a disaster to, I guess, try and seek some funds back from that? Because every business that I know as of right now has
Falls in.
COVID-19 that they're gonna charge all these funds to, whether it's sending somebody home for 14 days that doesn't have the personal leave and vacation, or reimbursement at the end of the year, so.
Right, so that's a good question. Our emergency manager, Ty Gates, said that like the hospital district, the town, they all declare a disaster declaration. So I wanted to clear it up with our lawyers first before I submitted that paperwork. I don't know if we need to or not, based on what the governor has stated. So we'll see.
And it also opens up funds from our property and liability fund for like ceasing operations, having that designation.
So you're talking about your insurance, they're still
It's
questioning
twofold.
that too,
Right.
because that's something like my business should be available to as cease operation funds, but insurances are balking at it because one of the criteria is it disease can't be the reason for doing that. But when you have state closing your business down, that's a different, yeah, it's because of the disease, but it's also a
So
mandatory
legal-
closure.
Legal mandatory.
So they're working on those things with insurance companies right now so that those funds can become possibly available. That's one of the things I first checked on when my RRs came down to, stop doing dining. So we'll see how that works out. I don't know.
I've heard different percentages. One of them's 100%, one of them's 75-25. As far as I know, I've never seen the government reimburse us 100%. So
Might be a shocker, wouldn't it?
So we'll see.
Although that's what they're supposed to do with restaurants for any layoffs or cutting of payroll, they're supposed to give us 100%. I don't know. You're right. Whether it comes through, actually, it's through a loan, but a forgivable loan. So they're going to loan us the money. I don't know how this works, but they're going to loan us the money and then forgive it. But you have to meet criteria in order to forgive it. So they have to just check on you and make sure you're doing it legitimately. But I don't know. We'll see how it works. You're right.
Do you have any more questions about what we're doing? Hopefully we can get the message out. We're sending daily updates at 4:00. So it's on Facebook. We're sending out this in the town
We're putting it in a utility
utility bill.
and then once we have it finalized, we'll print it and do, a direct mail, so it goes to every resident in the community, whether they, every resident, so. We have message boards that we'll be putting out. John has one, he'll put it in his restaurant, and we'll put it I'm gonna check with the post office tomorrow, the bank, and the grocery store. If you guys have any other suggestions, I can
Town
check
hall?
on the town. And then we'll put our daily updates on that, as long as it's got education stuff on there as well. Just for people that don't have Facebook or, to get the word to them.
Yeah, Facebook's a primary way of communicating right now.
And we have, through Lisa and Jeannie at the town, they have a gal lined up to make phone calls to at-risk populations.
For well checks, yeah.
And let them know about all the services that we're offering as a community and get them signed up for whether it's Meals on Wheels or prescription delivery or grocery delivery. Just make sure they know and kind of help coordinate that.
Have you guys got to the point where you have to solicit for volunteers yet for all this extra stuff that you're taking on?
We'll get to that point, but we haven't got there yet. We're just getting the word out right now, but the Meals on Wheels, we might be asking for some volunteers. And then there's some other things that the town's kind of taking charge of that as well, and they
really stepped in and helped.
Yeah, they're doing a good job, so.
So that's it as far as we go tonight. We had one item that we shelved or tabled from last meeting, and that was to finalize Kyle's incentive in his contract. We did not get that finished, so we're going to try to get that done, get his contract finalized. But other than that, we didn't get that done, so.
We kind of tabled the donation to the Rangeley Food Pantry as well. Do we need to do anything?
Yeah, we probably should make a motion and a vote on donating that money. So if somebody would make a
How
motion.
much?
Oh, we already did.
500?
500.
Yeah,
We already did.
didn't you motion already?
Okay.
Yeah.
I must have asleep.
Wasn't the one for the foundation dinner?
No, that
Did you
was,
vote?
no,
No.
that
No,
was.
we didn't have to vote on that one. I don't think. Did we?
No.
Okay.
Yeah, and I have that you did make a motion and vote for the.
Yeah, I thought we did on that one, yeah.
If we do it again, we're gonna pay $1,000.
Renee will be very happy.
So with that being said, there's nothing else, no other questions or comments, we'll go ahead and entertain a motion for adjournment, and we'll be finished for tonight.
I'll propose a motion to adjourn.
All in favor, say aye.
Aye.
Any opposed, same sign.
7:30.
Thank you.
Wow.